For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon. My name is Nick Miller. I'm a board member with the Sacramento Press Club, and we're inviting you to our luncheon conversation today. It's sponsored by HealthNet, and we have a very special guest, Dr. Anthony Fauci, is joining us from Washington. As many of you know, he's the director of the National Institute of Allergy and Infectious Diseases. He's also one of the lead members of the White House Coronavirus Task Force. And he's going to be interviewed today by Sammy Caiola. Sammy is a healthcare reporter with Cap Radio, which is the NPR station in Sacramento, California. Sammy, Dr. Fauci, welcome.
Thank you. It's good to be with you.
Dr. Fauci, thank you so much for joining us today. As you know, here in California, Governor Gavin Newsom issued stay-at-home orders early on and recently started the process of reopening the economy. Where do you think our approach has succeeded, and how has it fallen short compared to other states that you've looked at?
Well, I think, as you know, the governor has really been ahead of the curve in doing what he did to save California from having worse of a situation than they have compared to other large states and important states in the country. One of the things that I think is really important is that as you start to open up and follow what you call the guidelines for opening America again, which I'm sure many of your listeners are familiar with, you have to start off by passing a gateway checkpoint. And if you succeed, you go to phase 1. If you succeed, you'll go to phase 2, and then ultimately phase 3. Each of those have some restrictions. The thing I'm concerned about, I think that from the leadership that I'm seeing, it's being done correctly, but there's a difference of when you open up, namely following the guidelines, and what the people of California do in response to that. What we're seeing in some states that are having difficulty is that a leader, that leader might be a governor or a mayor, says, okay, here's what we're going to do. We're going to follow these guidelines. And particularly young people, because if you look at the people right now who are getting infected, if you look at the curve of the country, you have cities and metropolitan areas like New York going way down, and then you have others where the cases are coming up. And that's the reason why the curve of the country is flat, if not going up a bit, when it should be really going down. So what is happening as locations, be they whole states or cities or counties, open up, we're seeing a disconnect between what are the restrictions, guidelines for slowly taking the next step, being jumped over by many people, usually young people, who think that now that we're opening means all or none, black or white, either no restrictions or lockdown. There's a big difference between the two. And what we're seeing when you see on the radio, see on TV or in actual still pictures, people congregating without masks, even in a state or a city that is in a phase when they still should be doing some social distancing. They still should be wearing masks, and they're not. So I don't think it's anything that the state of California is doing wrong or not. It's what the response of the people are to what the opening process is.
Right. And unfortunately, since we started lifting restrictions on businesses, we are seeing an uptick in hospitalizations. Now, Governor Newsom actually said earlier this morning that he isn't planning to shut down the economy at this point. But do you think either now or looking toward the fall that we should be considering reclosing certain sectors or even the state? Why or why not?
I leave that. I've dealt with Gavin Newsom a fair amount, and be that on governor's calls or in person. He's got a really good sense of what's to do. So I'm not going to recommend it, except that in many respects, I agree with him. You don't really need to go back to lockdown. You need to pause and say, wait a minute, we're starting to opening and things aren't going right. What do we need to do to correct that? Now, you may need to stay where you are and impose a few more restrictions or maybe back up a little. But again, just like you don't want to open in an all or none, you don't want to start locking down completely because, I mean, ultimately that's always a possibility, but I wouldn't be saying that right now. Getting back to what I said before, I really do think we need to emphasize that. And it's not that you're blaming young people. I mean, that's going nowhere. What you're saying is that it's totally understandable, the urge to get back as quickly as you can to what you perceive as normal in your life. And I know when I was at that age, what normal would be, you work hard and you have a lot of fun. That's what life is all about. But the interesting thing is, although you think you may not be as vulnerable to the serious consequences of getting infected, well, you could say, well, if I get infected, who cares? Most of the young people do real well, and it's no big deal. But you've got to realize that you're part of a dynamic pandemic process. So you're getting infected, even though you don't realize it, is propagating the continuance of the outbreak. Because when you get infected, even if you're without symptoms, or even if you have mild symptoms, the chances are strong that you're going to infect somebody else, who will infect somebody else, who then will infect the vulnerable person. A grandmother, a grandfather, an uncle, or a cousin who has leukemia and is on chemotherapy. That's how your responsibility is not just individual. There really is a societal responsibility there.
Absolutely. And thank you for emphasizing that. It's such an important message for people to hear right now. I'd talk a little more about face coverings. Our statewide health orders ask people to wear them, but we're seeing lots of people are not doing that. What sorts of messaging can elected officials or public health officials put out to get people to comply?
Well, that's why I'm here on your show with you, is to really do exactly that. There's no doubt. I mean, I think there was some confusion about masks in the beginning, and it's unfortunate it gave a mixed message. It was at a time when personal protective equipment, including masks, were in short supply. And it was clear that the people who really needed them were the healthcare workers who bravely put themselves in harm's way at a risk to take care of people with COVID disease. Now we have plenty of masks, and we know that cloth coverings can work as well as some masks. So everybody should wear a mask when out in public. Keep 6 feet distance. Don't congregate. If for one reason or other you are going to congregate, namely you're not listening to me, plan A is don't congregate. Plan B is that if you do congregate, wear a mask and keep the mask on all the time. Because your tendency is when you get animated and you start doing that, you pull the mask down. Don't do that. It really does not only protect you, but protects others in case you might have an infection that you don't even know about.
But face coverings have become a polarizing or political issue. How can we get past that?
There's no secret formula for that except to say, get past it. It should not be a political issue. It is purely a public health issue. Forget the politics. Look at the data. It's very clear that when you do meta-analysis of mask wearing versus not in different countries, it makes a difference. It isn't perfect, but you don't want the perfect to be the enemy of the good. There is a significant advantage in protecting yourself from acquisition and protecting others from acquisition, right?
Hospitals here in California are still bracing for a surge, and they expect they will have to maintain capacity for many months to come. What does the U.S. experience over the past few months tell us about how California could better prepare for another pandemic of this scale?
Yeah, what they need to do, and it should be done not only by California, but it should be done at the national level. And that is even in areas where there is a diminution of infection and diminution of hospitalization, we still need to build up the stockpile. The stockpile in the beginning was not adequate to really address the major surges we were seeing, particularly in the northeastern part of the country, in the New York metropolitan area. But right now we have some time. I mean, we're not where we want to be because we want to see that curve come way down. It hasn't come down. If you look at it, it's in every newspaper you read. Almost everyone has somewhere in the newspaper, you have that chart that shows where the rate of infection is. Yesterday, we had something like 35 or 37,000 new cases of coronavirus disease, new cases. Remember, there was a talk that we started off at 30, we went down to 25 and then 20, and everybody was very happy that it was coming down in the right direction. Now it's not, it's going back up.
Right. So California hospitals, if they've been able to maintain the capacity that they originally built up, what will happen to them if we do see a surge? And will they have another backup after that? Or how can they create one?
We hope not. That's the reason why I think it's time to start preparing. Each state, the one thing I've learned not to do is that you don't go in and telling people what they should do. I have found that when you lead, first of all, you set the general principles. And I think by your question, you've already set the general principles. We have the possibility of a surge of cases. Do we have enough backup to handle them? If we don't, let's start building it up. And I leave to the creativity of the people in your state. Your governor for sure has that. Your mayors, who clearly have that, your health officials, of knowing what to do, is that don't wait for it to happen. Start doing it now.
Thank you. Thank you for answering that question so eloquently. People of color are experiencing the highest death rates from COVID-19 across the US. This is a huge concern here in California. What can be done to prevent spread in these communities and to reverse the underlying health disparities that make some groups more vulnerable to this virus?
Okay, so question one is an immediate solution. Question two is a decades-long solution. Okay, so what you do is you concentrate resources in those areas where demographically you have a concentration of the vulnerable from the standpoint of ethnicity, race. African Americans, Latinx, clearly Native Americans, clearly because of a number of reasons, immediately have a higher risk of infection because they have a disproportionate number of jobs that are so-called essential, where they're outside, not being able to separate themselves, interacting with people. So their risk of getting infected already is higher than the general population. Then when they do get infected, they have your second issue, namely they have underlying conditions that are caused by the social determinants of health that have been around for such a long time. They have higher degrees of hypertension. They have higher degrees of diabetes. They have higher degrees of obesity. You've got to address that in the immediate and long run. But for the immediate time, make sure there are the resources and the healthcare availability so that you could diagnose, identify, contact trace, and get people who are at risk because of their demographic group into the appropriate care as quickly as possible.
So you're talking about creating testing sites in underserved neighborhoods.
Absolutely. Concentrate those resources where they are.
Right. How far will that take us in being able to treat people when they have it or prevent them from spreading it to others?
Well, you're not going to turn around the healthcare delivery system overnight for sure, because there's systemic difficulties with that. But to the extent possible, try and get accessibility to healthcare in those areas that are now vulnerable. We know what we need to do a year, 2, 3, 4 years from now. But right now, you've got to address that vulnerability.
Absolutely. So I want to talk about the moment that we're in. You have been saying that the next few weeks are going to be crucial, especially for Sunbelt states such as Texas and Arizona and Florida. Is California in that position? How crucial are the next few weeks for us?
I think it is. I don't think it's as dramatic and as Florida is right now, because if you look at Florida has just gotten a lot of new cases. I think California is starting to see little bits of surges at the community level as they're opening up. I think if you're not, and I say if you're not careful, I know you're going to be. I think that from the administrative standpoint, that you have a good handle on what things to do. getting back to what I started off in the beginning of the interview, Sammy, I know we've got to get the population to realize that we're all in this together. It is not, I'm taking care of myself, I don't really care about you. But what you do will have an impact on others. And Californians have risen to the occasion on social issues so well in the past. You've been the leaders in the country on those things. This is an issue that really has social responsibility associated with it.
Yeah, well, thank you for the compliment on behalf of California. We will try to keep doing you proud. I want to ask one more question about skilled nursing facilities and senior homes. This is an area where we've seen some major outbreaks, and it's one of the hardest environments to control. What guidance can you give California on how to protect the vulnerable seniors that live in these congregate settings?
Yeah, that's a great question. One of the things we've learned from when there have been outbreaks in facilities that are generally confined facilities, be they prisons, be they cruise ships, naval vessels, nursing homes, is that often, you could test everybody in the facility once and then say, we know that the people there are at least baseline not infected, and then intermittently screen them. But importantly, do not expose them to people who might be at high risk, so that when you have the staff that take care of people in these facilities, make sure they very, very strictly follow infection control. Masks, frequent hand washing, availability of non-sink Purell type things wherever they go in, washing hands when you go into a room, when you come out of a room, keep your mask on at all time, because often it's an outside innocent person that brings an infection into a facility like an extended care facility, and then it spreads like wildfire. That's one of the recommendations I think that's really important.
Thank you. And one of the problems that we're seeing a lot, and I'm hearing this from county health officers, is that now that businesses are open, people are starting to get together again, family gatherings, birthday parties, barbecues, and that's where a lot of our contact tracing is showing the cases are popping up. Right. What messaging can we give to discourage people from gathering in that way?
Yeah, I do that, Sammy, and then I'm the Grinch that stole fun, the anti-fun guy. I think it gets back to the original message that we were saying. It's so understandable, the urge and the need to get back to normal, especially since a lot of that centers around socialization with the people you care about. I mean, that's such a natural instinct in life. Unfortunately, we have to put that aside a bit and realize that if the particular guideline that you are in right now says avoid congregation, keep 6 foot, you got to try to the best of your ability to have your social interactions in a modified way. It gets back to what I said in the beginning of the interview. It's not all or none. It's not lockdown or caution to the wind. There is an intermediate in there, and that's what we've got to do. We've got to do the fundamental basics. And you mentioned it before. Masks are important, social distancing. And there's so many creative ways to do that. You could have people over who you can keep 6 feet apart, masks on as you're talking. When you eat, obviously, you got to take your mask off. But that decreases the risk a lot if you do some sort of mitigation of risk by the kind of physical distancing without necessarily shutting off all social interaction.
Right. Who wants to do that? How long can we do that, really?
It's very tough. It's very tough.
Dr. Fauci, what did I not ask you? What would you like to share? What do people need to know?
No, I think you asked all the appropriate and relevant questions, Sammy, but I also think that people need to realize, as difficult as this is for all of us, more than just inconvenience, the terrible toll on the economy, on jobs for people who need to support their family. That's serious business. This will end, but it will end because we will be doing things to make it end. It's not going to end spontaneously. So the things that we're doing that are uncomfortable now because they're restrictive are the very thing that are going to get us to normality. So the good news is that it will end, I promise you. The sobering news is that we got a lot of work to do to get there.
And I believe your time is up, but I am so grateful that you were able to join us for this segment today. And thank you.
My pleasure. I appreciate you giving me the opportunity to chat with you.
Bye, Dr. Fauci.
Well, I'm going to go ahead and kick off with the questions because I think that we have a wonderful panel here. I'm Samantha Young with Kaiser Health News and California Healthline, and welcome to all of our great panelists here. I have Dr. Cody with the Public Health Officer of Santa Clara, Assemblyman Jim Wood, the Assembly, welcome with the Assembly, the Chair of the Assembly Health Committee, and Dr. Sara Medeiros, who is the Emergency Room Doctor with UC Davis. So welcome all of you. Thank you for joining us here today. Dr. Cody, I would like to start off with the first question. I'm sure you all heard Dr. Fauci's comments here that we had today, and really talking about, you were the first here in California to issue stay-at-home orders, and your county is moving very carefully and very slowly on reopening, and I know that is something that you have been criticized for, but California did flatten the curve, and now that we are slowly reopening, we are starting to see the increases in cases, increases in hospitalizations in some part of the states. And so I'm curious about your opinion. Are we reopening too fast? If you were designing how California reopened, what would that look like?
Thank you, and thank you so much for inviting me to be here. I really, really appreciate it. I want to clarify one thing. When we decided to issue the shelter in place in the Bay Area, we did it as a team of health officers around the Bay Area. We're colleagues that have known each other for many years, and that is, I think, one of our great strengths, that we could do things together. So I just really want to make sure everyone knows it wasn't just me. I was part of a fabulous team of fellow health officers. I really appreciated Dr. Fauci's comments. I think, as always, he is so wise in how he describes this, and it's hard work. We can get there, but the sobering part is we have to keep at it. And our sense of things and strategy here in Santa Clara County is that we need to move and slow, gradual, measured steps, mostly because the indicators that we watch lag. And we want to make sure that we're not getting ourselves into trouble before we open further. So that's sort of one of the main reasons that we're moving in a measured way, like take a step and then watch for a few weeks to see what the impact is. Of course, it's getting enormously complicated because here in the county and in the state and in the nation, we're making decisions in the context of a pandemic that is global. This was our challenge at the very beginning as a county where we have an extraordinarily diverse population living in our community, where people travel a lot for business or for pleasure. We did anticipate we'd be one of the first jurisdictions to see cases, and indeed we did. And just now we're, of course, trying to manage a pandemic. We're making decisions locally, but the pandemic is global. And it's challenging because as people open up around us, it has an impact on the case and hospitalization trends here in our county. We're not an island, and so we have to sort of take the whole context into account as we make our decisions.
Thank you.
I'd like to ask all of you a question that I asked Dr. Fauci earlier, which was about these informal gatherings of family and friends that we've been seeing. People seem to just be done with social isolation. They all say they want to go out and live their lives. So what messaging can elected officials and health departments be giving to the public about how to behave right now? Any of you can take it.
You said elected officials, so I'll take a stab at it. Okay. I think it really is. It's got to be constant communication and being vigilant. You're right. The social isolation has been really hard on people, and we are social by nature, and not being able to participate in the things that we normally do has been really, really hard, especially around family. When you get around graduations and birthdays and those kinds of events, that it's really, really difficult. But I keep telling people, look, the masks and all these precautions are about protecting other people, not yourself. And you need to be aware of that, especially family members that are older. But now we're seeing the numbers change and the ages change. But it is a constant, reinforcement of we're in this for the long haul. We just don't know how long the haul is, but we have to keep it up.
Thank you.
Dr. Cody, Dr. Medeiros, would you like to add?
I'll just add from a medical perspective, and thank you for having me today. A lot of the patients that I see that are coming in that are COVID positive have no idea how they got it. And so I think that we do have to be careful because we still don't really know when the virus starts to spread and whether it's spreading when people are pre-symptomatic or asymptomatic. We think that is happening. We don't totally know how much. But I'm seeing people coming in who think they've been doing a great job distancing and they are still testing positive. So I do think we really need to be careful. We talk about this sort of new normal, and we talk about this all the time in the ER. And I think people at home need to sort of accept a new normal, at least for a while, until we have a good vaccine or reliable treatments, and just be smart about it.
I would say my observation is really to acknowledge that we sort of have this collective grieving process for our old way, our old life that we used to have, and we're all grieving, but everyone is kind of in a different place. Some are still at denial, some are at anger, some are at depression, some are bargaining, and very few of us have come to the acceptance part. And so when I think about both the appetite and the eagerness to reopen, which I think did happen, in retrospect, I think we can say it happened a little sooner than it should have. But at the same time, it is understandable because I think that we are all collectively grieving for the life that we don't have anymore and desperately want to get back to it. So I kind of feel like that's part of the dynamic, and so in many ways I think that the pivot to more of a harm reduction model and really emphasizing the importance of face coverings and the importance of limiting the amount of interactions that you have, limiting the number of times that you go out, and limiting the number of people with whom you interact is really, really, really important, and maybe a more adaptive way to get us to acceptance of the way that we need to be living, because Mother Nature has told us that this virus is going to be with us for a bit more.
Dr. Cody, to touch back on face coverings, if Governor Newsom's statewide order to wear them doesn't work, then what's next? Do you think we have to shut down again or go back to staying at home? I'd love your thoughts on this and everyone else's.
Thank you. Well, it's not really a binary question, just as I've always said that I think that the lives versus livelihoods is also a false choice. I think the truth is that this is incredibly complex, involves a great deal of uncertainty, which none of us like. And it's really about layering various prevention strategies and trying as best as we can to stay true to each of them. And so the strategies are the ones that we've all heard about. Face coverings is but one, an incredibly important one. But keeping our physical distance is also important, as is frequent testing, particularly for people who have frequent opportunity for exposure. And then, of course, contact tracing is an incredibly important part of prevention as well. So we just have to get all of our different prevention and control strategies lined up, and be strategic, ensure they're resourced, and ensure that we can maintain them.
Thank you.
Assemblymember Wood, I wanted to ask you, there are a number of bills in the legislature this session to respond to COVID. And so I'm curious what you think that the state can do, that the lawmakers can do to respond. We've heard a lot about stockpiling PPE, more money for counties and contact tracers. What do you think, in your position, chair of the health committee, what can lawmakers do to try to combat this?
Well, first I would say that this is still evolving. And so, I as a legislator, I'll take credit for some of this, but we often tend to jump and want to do something right away without really understanding the enormity of the issue and where we need to go further in the future. And so I tend to be a little bit cautious about the things that I do as far as legislatively. I think, when there is something happening out there, we often run to try to introduce a bill to deal with that. I tend to want to take a different approach where I gather more information and look to see how we can do this in a more holistic manner. The thing that has concerned me from the beginning when we started to see the virus in Washington is how people in either skilled nursing facilities or assisted living were disproportionately impacted. And so one of the things was, reporting requirements. And that's a bill that I introduced because we wanted as close to real time as possible how, the number of cases and the number of deaths that are happening in nursing homes to hopefully, try to give opportunities for people like Dr. Medeiros and Dr. Cody to be, better able to do their job, to understand the dynamics of that. But, the PPE is obviously a huge challenge as well. I still struggle at this point to say, what is a cohesive strategy? But I think we will have hearings to gather more information, probably in the fall or after our session. And I think that will help us to gather the information to actually do something that I would hope is more comprehensive and less of a knee-jerk reaction.
Thank you. Dr. Cody, in your county, you've really talked about testing and how critical that is, but there are still barriers to getting a lot of people tested. And I was hoping you could describe your approach in your county, and not just relying on the public testing sites, but also you directed the private health systems there to ensure that testing was available. Can you talk about that and why that was so needed?
Certainly. So testing, of course, is central to everything that we do. Testing this is our eyes. And I've often sort of described our problem as early on, it was like a picture where not many of the pixels were filled in. And tests are the way that we fill in the pixels so that we know what's going on. We know where to focus resources. We were really struggling to get our testing numbers up to feel confident that we were filling in enough of the pixels to understand the patterns of infection in our community. And everyone was really relying on the public sector as though it was a sort of a problem over there, right? Oh, well, the county is responding. The county needs to do more testing sites. The county over there. When really COVID is an infection like many other infections or conditions where you would ordinarily go to your provider to screen you for that. You go to your provider to screen you for HIV, to screen you for hepatitis C, for hepatitis B, et cetera, et cetera. And that's sort of part of accessing the healthcare system. And I think, and so that's sort of one. And the other is we really need the partnership of healthcare systems to help us lift and ensure that everyone who needs a test gets a test. So it was both sort of philosophical and practical. So I issued a health officer order that was directed not at every provider, but at the large hospitals and hospital systems that have clinics. So this directs them to test 3 different groups. One is anyone with COVID symptoms. So if someone with COVID symptoms comes into your clinic or your emergency department, you must test them. That seems pretty basic, but it actually wasn't happening. So this is an order to say you must do this. The second is anyone who is a contact to a confirmed case. So we're doing an incredible amount of, reaching out to people who are infected, asking to understand who other contacts may have been, but it's really, really important that those contacts get tested. And when you have the number of cases reported every day and the number of contacts that they have, the public health system cannot ensure rapid testing of all of those people. We need everyone to help us lift. So that was the second group. And then the third is, particularly as we open and people go back to work, and for our essential workers who have been working this entire time, there's a lot of people who have increased risk, increased exposure that really they can't control. So if you are, a bus driver, if you are a grocery store clerk, if you work in a pharmacy, you're going to have a lot of opportunity for exposure. And it's critical that those people have access to testing as well. So that was the third group. So our strategy in the county, which has enabled us to bring up our testing and kind of help fill out the pixels in the picture, is we as the county entity are still doing more testing than any other entity in the county by far. But we have also directed our healthcare systems, ordered them to test these three groups. So if they don't have the capacity now, they either need to build it or they need to contract with someone who has it.
And in terms of building that capacity, I want to ask also, how can California prepare for another pandemic of this scale should it happen again? How do we avoid what we saw early on with the shortage of PPE? How do we get more contact tracers available? How do we build that capacity?
I think it's absolutely critical. I think we have learned so much from this pandemic. And if I were to name one root cause, I would say that it's been a very, very, very shaky public health infrastructure and public health preparedness. And this has been true for many decades. And now it's been revealed in the most public way, the faults in our public health infrastructure at the local, state, and national level. And it's not just about addressing the infrastructure in a county or in a state. It's about addressing the infrastructure across the country because all of our systems are linked. And there's a couple key parts to it. The data infrastructure, just to exchange information to understand what's going on. The workforce. We in Santa Clara County now, pretty much everyone in the county is now a public health worker for all intents and purposes. And it's been amazing. I love to see everyone be a public health worker, but we clearly need to build the pipeline. And then also just the infrastructure for response. But that's kind of like the very end of the line. Of course, you need to have stockpiled PPE and other resources that you need if you get into a big pickle, which we're in now. But more importantly, we need to build all of the infrastructure that enables us to prevent these catastrophes from happening in the first place.
Dr. Wood, I'd like to hear your response to that, because I know that's an issue that has come up before your committee in years past, even before this pandemic.
Yeah, thank you for that. Because for me, you can't build the infrastructure without resources, and that is a huge challenge. And so, I represent a district that is very rural, and one of my counties in particular has a public health department of 2 people, and no public health lab, and so everything has to be shipped out. And so when it comes to testing, we've had real struggles in getting testing capacity. We've had, in one of my counties, we had an uptick in hepatitis C and STDs, sexually transmitted diseases, and there weren't the resources there to actually adequately go after these conditions and challenges. and add to that, and I'll say this, and others may not, but counties and will often take and redirect resources away from public health when the need arises, and that's a problem for us as well. I think this pandemic has laid bare the fact that we are not prepared for things like this, and we have to, in my opinion, we have to double down on this and really reinvest in the infrastructure and ongoing resources so that we can be more vigilant. I hope that we don't have another pandemic like this, but there will be other things that come up over time, like a spike, maybe in HIV, maybe it's again in STDs or hepatitis C. And health departments need the resources to be able to respond quickly and appropriately. And right now they're struggling with that. And at a time when we're seeing huge budget shortfalls, I think we need to be really pushing for more investments in this area.
And Dr. Medeiros, how much do hospitals rely on a good local health department?
Yeah, I mean, it's crucial. It's essential, right? So, in the emergency room, we've been lucky at UC Davis where we have a very good test. So our pathologists and our infectious disease docs were working early on to get us a good test and to ramp up testing. And so now we have a really solid test, and we run a couple batches a day and can get a result within 24 hours. And that's been huge. But I think, the lack of contact tracing early on and the lack of test availability early on, I think really hurt us. But I mean, I also think we need to remember that this pandemic is not over. We're seeing big increases again in numbers of cases. And so we still have to figure this out to get through this.
I'm wondering, as it's been talked about that we're still in the first wave in California. And we know that the hospitalizations are going up here. The hospital beds are certainly filling up in Arizona, in Florida, in Texas. And I'm wondering if hospitals here, are they prepared? We made a lot of plans and preparation in the spring, and that surge never came. So are we prepared for a surge later this summer, in the fall? All that planning, is that going to help us? Or are we going to find ourselves in the position where our beds are going to be filled up and we're going to have to look to alternative care sites? Do any of you have a sense of where we may be?
I can tell you what we have been doing in the ER at UC Davis. And so there's been a huge effort really since this started. And one of the kind of neat things about this pandemic was the sharing of information. So as soon as cases started to ramp up in China, and then really in Italy and throughout Europe and then New York, there was a huge amount of collaboration on social media and on various websites and, sharing all the information that was available. So we were lucky in Sacramento in the sense that we had a little bit of a heads up and we had some time to prepare. So our chair, Nate Cooperman, has been really on top of this from the beginning. We've had, sort of weekly faculty meetings talking about what are the latest treatments, what are the latest things we need to know, the latest diagnostics, the latest trends. We have groups of people who have been working in their spare time to get things going, like let's figure out our best airway equipment and what are some things that we can kind of, put together to reduce transmission and to treat these patients most effectively. We've had some of our toxicologists looking into the current treatments and what are the best ones and what are some of the problems, what are the side effects. We've had our SIM team who came in on their days off morning after morning after morning to make sure that we all were comfortable donning all of our protective equipment and intubating and doing these risky procedures. So I think from that standpoint, our doctors are really prepared. Our nurses are really prepared. We're ready for it. We didn't see that big surge that other places did see. We are much better prepared with PPE. We've been fine at UC Davis. I know some other hospitals have struggled, but all of our attendings now have the elastomeric silicone N95s, which are reusable. So that's been helpful as well. But I'll also say, on our podcast, EM Pulse, we were lucky enough to interview some docs that were in some of the harder hit areas. So I spoke with Leslie Pomerlee, who's a physician in New Orleans, and we spoke with Dr. Astua, who's the chair of critical care at Elmhurst Hospital in New York. And one thing that came through from both of them was that the surge really hit them overnight. So even knowing that it was coming, they'd see a few patients kind of trickle in. And then overnight, there was just this huge wave of patients that came in, and they had to figure out how to turn wards into ICUs and things like that. So we are preparing some of that as well, talking to our colleagues who can help. Can our family medicine doctors help us in the ER? They're prepared to do that if needed. A lot of our internal medicine doctors and surgeons who care for critical care patients are prepared to take over, extra ICUs that are created. So all of that's happening.
I'm wondering if anybody else would like to.
I'd like to add something, just a different perspective. So, like I said, I represent a largely rural area, and so I have in my district, I have 6 critical access hospitals. Those are 25 beds or less. That's out of 34 in the state. So our ICU capacity in those hospitals is pretty limited. And so if we get a wave of cases, and a wave to us could be a half a dozen, it's going to be a real challenge to respond. And so this is a big state with a lot of diversity out there. And, we don't have alternate care sites available that I'm aware of in the district. And so if we start to see a wave of this throughout the state, I worry, what happens to some of my constituents, transportation from Del Norte County to the Bay Area, where is a +hour adventure if the roads are open. We rely a lot on Reach helicopter for air ambulances, and so the challenges in a metropolitan area are enormous from a different perspective. But for us, just because we don't have the capacity to deal with it, I worry. And sadly, in a lot of my communities, people simply aren't taking a lot of these precautions seriously. And so this constant reinforcement is really critical to us.
And Dr. Cody, I know you need to leave us a few minutes early, so I wanted to give you an opportunity to make any sort of final comment on this question.
So we started preparing very intensively. We were worried that we were going to look like New York. We didn't know whether the shelter in place was going to work. And we stood up this huge unit in our emergency operations center with 50 or so people that were working on, a number of different scopes of work, ventilators, personal protective equipment, staffing, ethics, working with every single hospital very intensively. We had an alternate care site for a while that we've since been able to stand down. We were looking for, alternate sites for extra skilled nursing facilities, et cetera, did an enormous amount of work. And our hospitals have remained, largely empty, which is good. So at the moment, across our system, we have a lot of capacity, but the point is we don't want to use it. So I think that if we got an overnight surge, as you're describing they experienced in New York, we would probably be able to absorb much of that surge. But the question is for how long? And then the other issue is all the other people who need care for other things, we want to be able to ensure that they both have the care available and very importantly, that they will access it. So we saw in our county, as many communities saw, we created enormous capacity in the hospitals, but then people weren't accessing care because they were worried about being exposed to COVID when they came into a healthcare facility. So we've worked really hard, not just to ensure that there isn't a risk, that they are safe, as well as to educate the public so that they really do feel safe. And this goes back to prevention. The critical thing is that we need to ensure that we have this layered prevention approach so that we drive down the overall prevalence of COVID in the community. That's going to protect our hospitals, our skilled nursing facilities, vulnerable communities, and everyone across the board. But we all have to row together, and that has been a bit of a challenge.
Well, thank you. And thank you for joining us today.
All right. Thank you so much. It's really lovely to meet you all. I really appreciated the opportunity. Bye-bye.
We did have a few more questions for the rest of our panelists. Sammy, I know you had the next question.
Yeah, I wanted to talk to Dr. Medeiros a little bit about what it's like to work in the hospital environment with a family at home. What are you doing to protect yourself and your family and still live your life?
Yeah, that's a great question. I've definitely made a lot of changes. When this first came out, there, I think, was a lot of anxiety, a lot of apprehension. Like Dr. Cody said, we didn't know if we were going to see a surge like New York did. So my husband moved to our guest room. He now shares the bathroom with my kids. And we had kind of talked about maybe we're ready to stop that. But then with these increased cases, we're kind of holding back on that too. I've developed a routine for how I get ready and make sure that I put on all my equipment and make sure that I, take all of it off before I come home. So the hospital's been great, and they've given us scrubs to be able to use and then turn in at the hospital and wash there. So I get my scrubs from the hospital, I put them on, I have a head covering that I wear, I have goggles that I wear, get my mask on, make sure I have everything, and kind of wipe down everything before I start my shift, sometimes during my shift, and then definitely at the end or after any patient that I'm concerned about. And then at the end of my shift, I, really carefully wipe everything down, wash everything, take my goggles off, put everything in kind of a dirty bag, go and shower at the hospital, leave my dirty scrubs there, and then come home clean. But I'm still the biggest risk factor for my family. So we haven't seen my parents or my sister and her husband who live in town because they all have health risk factors. And so we've been staying away from them, and it's hard.
I'm sure. I can't even imagine, but it really sounds like you're leading by example there and taking the precautions you have to. So, and on the topic of kids, I have been hearing that some parents are worried about taking their children into the doctor's office for routine screenings or even for vaccinations. What messaging can we give people about visiting the doctor's office, especially for essentials like vaccines?
Yeah, so it's so important to keep up these important health maintenance things, right? So whether it's vaccines or labs that you need or whatever it is, these health maintenance visits are super important. And we see, I work in the emergency room, so I'm not in primary care, but we do see people coming in who have waited too long to get care. And I would emphasize to everybody that it is safe to come in right now. So all of our clinics, our ERs, they've taken, extreme precautions to make sure that patients are safe. We all want to stay safe. All of our staff want to stay safe, and we want our families to feel safe. So we make sure that there is universal masking, and that we try to make sure that waiting rooms are as minimally crowded as possible. If you are going to an appointment, they're staggering appointments or even doing a lot of telehealth visits. And all of that is making it even safer to come in. So wear your mask, but make sure that you get your care, because you could end up a lot sicker if you don't.
Thank you.
This question was asked of Dr. Fauci, and I'd like to ask Assemblyman Wood this about masks. And it has become such a political issue. Your district, you have urban and rural areas and people of many different political affiliations. So I'm curious, when you go about your district, what your constituents are telling you about masks, and is it a political issue in your district, and why, and how do we get it to become a public health issue?
Well, it's a great question. And I will be honest with you. I have been taking the shelter at home, orders pretty seriously. So honestly, I have not been out in a lot of my district, but I have district staff, and they report to me, and I talk with people in the district. I don't get the sense, quite honestly, that it is really political about masks and not masks. I sense more in my district that certainly in some areas that it is more of a libertarian personal freedom argument on their side. But it's also a part of the fact that we've had fewer cases than we have in many areas. And so that is really the bigger challenge from my perspective, is how do you continue to educate people about this? There are people, we hear this all the time, this idea, well, it's, my body, therefore. But there is a disconnect. There's a huge disconnect. And it's like, you're not wearing the mask for yourself. You're wearing the mask for somebody else. And so, but it is really frustrating and selfish, quite frankly, that people refuse to acknowledge the real value and the purpose of the mask, because it isn't about you. It's about the people around you, and they're wearing a mask to protect you. So, we've seen, folks that were, the anti-vaccine activists have now jumped on this bandwagon and my body, my choice again. And I find that really frustrating, because I don't think it's particularly well informed. And I wish we had a way to get around that. My district is kind of a microcosm of California. I've got libertarian, really conservative Republicans, and all the way to extremely progressive Democrats. I tend to see that the people that are the most willing to do what is asked of them tend to be people that are a little bit more progressive, or older people. It seems to be that our younger folks that feel they're invincible don't really want to go along with the program, and that's a concern to me as well. So it is a challenge. I don't really feel it as a political and versus the supporting the president or whatever. It is this unusual sort of libertarian bent that we have in parts of my district that make it really challenging.
And Dr. Medeiros, there's also the health issue that has been brought into this argument as well. And we had one viewer question about it, about breathing in carbon dioxide if you're wearing a mask. So would love to hear your response as to that.
Sure. So this is just really not a concern. So, if you talk to some of our surgeons, our surgical nurses, people that work in the OR, for decades, people have been wearing masks for long periods of time. Some of those cases are 15 hours or, they're these very long cases, and people are wearing masks all the time. And now all of our physicians, nurses, techs, everybody is wearing masks all the time. And we are not having health problems with this. There's not an issue of rebreathing carbon dioxide. You can even see some of the lab tests that people have had when we look at our blood gas and we look to see what people's carbon dioxide levels are, and it doesn't go up. So this is really not a concern. Most of the masks that people are wearing in the community are fabric masks, cotton masks, et cetera, and they breathe really well. So I would say that your health risk is much higher of getting the virus from not wearing the mask than it is of, breathing in CO2 from wearing the mask.
So I think we have a question that we probably know the answer, but we really want to ask it. In a perfect world, what does every single Californian need to do for this virus to go away, say, in the next month? Which is not possible, we know, but ideal world.
It's really idealistic. Sounds great. I mean, in theory, if everybody, stayed home and, just really didn't go out at all, then you wouldn't have any kind of transmission, but it's not realistic. So I think, Dr. Cody mentioned earlier, this sort of harm reduction approach where we just try to minimize the risk as much as possible. But I think we, in the ER, we talk about this as sort of a slow burn, and we're expecting this to be with us for a while.
I guess I would just say that we need to follow the best science that's available, and that is the social distancing, the masks, the hand washing, and as more things come along, we need to follow those as well. I think what is hard for people is that there really is no end in sight, and that is a challenge. And so as we reopen, following the social distancing and the masks and the hand washing become even more critical. It's pretty clear that we can't continue to live sheltered in place forever, and we're going to have to get out in our communities. But we've got to take these precautions to the best of our ability, and then in time we will have therapeutics that will help to treat this condition. We will have a vaccine in time, and I know that people want that. They want that goal. They want to know, when can I do this? When can I do that? And we simply don't know. And that's really hard for people. It's hard for me personally. And it's hard in my house as well, with my partner, who she's always asking, when can we do something different? And I get it. But there's so much we don't know. And if we don't take the precautions we know that actually have an effect now, the situation is going to be so much worse for us later on.
Thank you, Dr. Wood and Dr. Medeiros, for answering all of those questions as in depth as you did. It really gives people the information that they need to navigate this situation.
Yes. Yes, thanks again, Assemblyman Wood. Thank you so much.
Thanks. I didn't thank you in advance for the opportunity to be on here, so I'll thank you on the way out. So I really appreciate the opportunity to participate today.
Yeah, we're really grateful for your time. And Dr. Medeiros, thank you for your time as well. And we can learn more about your podcasts at ucdavisem.com. Is that correct?
That's right. Yeah, absolutely. And we're on iTunes. It's called EM Pulse. So check it out. We've had a lot of COVID related things recently, and talking about surge and everything. So there's a lot of good stuff on there. Thanks for having me.
Wonderful. No, thank you for your time again. I'm Nick Meller, the last person to learn how to use the mute button on Zoom in America. And I want to thank Samantha Young. She's a journalist with Kaiser Health News. You can support her work at khn.org. And Sammy Kayola with Cap Radio, and you can support her journalism at capradio.org. And you can support the Sacramento Press Club by visiting sacpressclub.org, and your donation helps aspiring and student journalists get scholarships so they can be part of our profession. So thanks again, everybody, for your time, and take care.
Thank you. You too.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.